Okay. This is the nervous one. So, I said earlier on today that I was going to do a video on weight gain and medication. So the reason that I'm doing this, if those of you who don't know before, is because it's a bit of a bone of contention with me. I've noticed quite a lot of nasty comments made on, it has to be said, women's YouTube videos who are overweight. And quite a lot of them are actually on psychiatric medication and have actually said that they're on psychiatric medication. However, there are a lot of people who are on YouTube who are overweight, and there's these nasty, nasty comments getting made to them. Now, I'm sick and tired of leaving little messages here and there, that get seen for maybe a week or a month or something, and then they disappear. So I thought, no, I'm going to do a video about this because it's really annoying me. I myself have bipolar disorder, and I also have an underactive thyroid. So I know what it's like to gain a substantial amount of weight because of psychiatric medication and just normal medication, well, normal illness, because obviously I was put on weight before the thyroid problem was discovered. So just to make sure, show you that I'm not lying, this was a picture of me which was taken about a month before I get put on lithium for the first time ever. I'm 5'10", and I was a size 8 all over at that point. I had a completely flat stomach. I do Pilates. I really enjoy it. I also did yoga for years and years and years. I've stopped doing the yoga so much now, and I do the Pilates a lot. So I've always been really health conscious. A treat in my house was raw carrots, and I'm actually not joking. To this day, I buy carrots and just chop them up and have them. I'm not sweet toothed at all. I don't eat cakes. My partner hates it. I don't have cakes or biscuits or chocolate in the house. I just hate that kind of food. I really don't have a sweet tooth. So basically, whenever I get told that I was getting put on lithium, I knew that there was room for weight gain, that there was going to be weight gain basically. So I was like, okay, no problem. I would rather be well in my mind and put on a few extra pounds than be thin and very, very, very unhappy and put my health at risk and the probability of dangerous activities, with obviously the worst case and the most probable case being suicide at the end of the day. So I was put on lithium and I gained about, in a year I think I gained, what was it, 10, 11, 12, 13, 3.5 stone. So I was 13.5 stone, which is about a stone and a half heavier than I should be for within the BMI chart, which I personally think is a load of rubbish. Anyway, so that I could deal with that. I could cope with it. It was fine. I also had an eating disorder when I was a teenager, so I felt I was doing brilliantly because I was like, 13.5 stone is quite heavy for me. And I was like, oh my goodness, to start off with, and then just completely, after about 2 weeks after I get weighed, I just went, well, no, Shona, you still look great and what have you. So it was like, well, fair enough. So then I got upped from 800 mg to a gram in October last year, and I put on 13, 14, 15, 16, 2.5 stone in 6 weeks. Obviously didn't change my diet. Nothing had changed whatsoever. And I get people, one of my nurses said to me, well, you must be drinking lots of fizzy juice for you to put on that weight. And it was like, well, 2.5 stone in 6 weeks. I think you'd have to be, gulping down fizzy drinks and just eating rubbish all day, to put on that amount of weight, and I wasn't doing this, and I was still exercising. Even though the lithium, you feel like your limbs are just getting dragged back. Every single movement you make is just impossible. So I said that I was going to show everybody what my tummy looks like now. It was obviously completely flat as a pancake, because my weight gain is extremely odd. It's very unusual weight gain, and I've been told that this is because of, you know, the fact that it's fluid retention. So I'm going to show you my stomach, because everybody usually sees my face, because I've got quite wee thin bony wrists, thin fingers. I've got quite small feet. I've got size 6 feet for someone that's 5'10". You probably won't be able to see it, but you can actually feel my ribs underneath my bust. So I'm going to go for it, and I'll show you how odd the weight gain can be with psychiatric medications. This is to make other people feel better, because nobody seems to discuss this. All that I see on websites is P-docs and P-nurses saying to people, exercise and change your diet. And, you know, I changed my diet. I ate less. I was eating, my dinner plate was a side plate. I was having coffee and fruit for breakfast, and half a sandwich for my lunch in December. Once I get weighed in December, and I got told I was 16 stone, which makes me obese for my height, which absolutely crushed me. And I mean, it was fair enough for me being overweight, but being told that I was obese, it was pretty horrific, and just took such a battering to my confidence. Obviously my relationship as well. I used to be very confident about my body, and now, you know, once I get weighed in December, I just became really I'm getting a wee bit upset. I turned into a bit of a mess, to be honest, about my body shape. So I just feel I have to do this, because I'm one of these people. It's like, even though I'm sort of hurting, I would rather use that hurt inside me to try and help other people maybe realise that they're not on their own. And this isn't just aimed at women, it's aimed at men as well. And it's not just about psychiatric medication, it's about, you know, you've seen the pictures of me when I was thin, and that was 18 months ago, and now I just want to show you my strange belly. So we'll all have a giggle about it. That's what we're going to do. So here it goes. So this is my lovely obese body. So this is the top of my tummy, and this is I might have to actually move the screen down a little bit. You can actually see my stretch marks there. The light's just caught them. I think I'm on the same on the other side as well. So yeah, this is the weird bit. I'm trying to move it the right way. It's not obscene or anything, don't worry. So if you see now, if I do my Pilates thing and I pull my stomach in, which see, it's really odd, isn't it? I don't know if I'm overreacting or anything, but I just think that's, when you look at this area, it's more or less, my bra size is the same as it used to be when I was a size 8, but it's just like, I have like a kind of overhangy gut area. And the other thing is, if you look like at here, it all gets really chunky here, and also my backside as well. Now I'm going to put it away, put the grotesqueness away. There we go, it's all over. My arms are the same size. My legs are the same size. I don't think that I look obese. That's why I was so shocked. Oh, I'm going to have to stop this actually and continue in another one. Hold on.